amount of money that you've been contracted to do runs out, do you carry on doing it at a cost and making a loss? Or do you as an organisation say, well, we've done the amount you gave us money for and stop? Well, if you stop at that point, who picks up the next ones? So whether what I'm talking about is a blood test, or a 999 call, or a person who turns up at ED, or a person who phones their GP practice, at some point, the organiser of that service has put an end to that. So there aren't limitless slots in all of those things. And where we've got a big problem at the moment is that with that disjointed service, sometimes there are things that impact like dominoes on the rest of the service. If there aren't enough district nurses, people end up with infected wounds instead of dressed wounds. If there isn't an ambulance, or if there isn't a GP appointment, that can be a pneumonia instead of a bronchitis. So there's a whole host of things that need to come together to fix this problem. Ultimately, when you end up in hospital, if you're sat in the ED waiting for an orthopaedic consultant, you're occupying a space in that department, and people who run the department will tell you there are a limited number of spaces. Once those spaces are all done, you're then into the corridor and waiting for a space. If those spaces are all filled up because there aren't enough beds on the wards, then those patients can't be moved out of ED. So there's a whole backlog that builds up then. So it has to be addressed as a whole thing. We need to get back to an NHS where we all work for the patient. Okay.
If we continue to get interruptions from the public, I will have to ask you to leave. We are here to listen to what officers have to tell us. It's part of a consultation. It's part of a consultation. This is not an open public meeting, as I've said before, but you're more than welcome to sit in and listen, but I would ask that you listen. Thank you.
So just to be absolutely clear, I have only ever worked for the NHS. I am not a private entity. I'm not working for a private entity. I never have. I never did. I've worked in ED when other people have done other things. I've done GP out of hours when other GPs wouldn't do GP out of hours. I've done GP out of hours. No one can question my commitment to the NHS as it is, because I can stand by my record of 30 years of commitment to the NHS. I am as red as anyone in this room, but I see that we need to do some things differently going forward, or we will all not get what we want when that time comes. And I think at some point we need to decide, is a sore throat or a splinter more important than a heart attack or a stroke? Where are your priorities? We need to ask these questions. I don't have the answers, but I want to be part of the solutions coming up with the answers.
Well, they're all priorities for the people who are suffering from that particular illness. And what my question was a financial question. Do you think these proposals are financial led or clinically led?
Well, as a clinician, every proposal that I make is clinically led, but it has to work within a financial envelope. I am not a commissioner, I'm a provider, so I don't get to make those decisions, and I don't have the data or the decision-making power for that, so it's probably best not asked of me. But I make my decisions on a clinical basis, but I can't pretend not to live in a world where there is a limited amount of resource.
Chair, I just want to make, I'm not putting you my personal philosophy of the NHS, etc., and Dr. Fraser is entitled to his philosophy of it. I do think that decisions should be made on clinical grounds, and to me, for a person in the north end of Burton who had a concern regarding a chest infection and a sore throat and a stroke is equally important, because I think they need access to the services to do that. I also believe that services should be commissioned and delivered in a cost-effective manner. And this is why I do not understand when you want to knock down a service that is delivering a service unfettered for 15 to 20 pounds and replace it with something that is going to cost 80 to 100 pounds. Because I don't understand how those decisions have been made. And that is why I would say that I think this needs to be thought through. Because if people can deliver these services at a cost-effective way, that means the people of Wirral, the CCT and others will have a lot more resources to put for the bigger things like urgent treatment and etc. So it's a combination of two things.
Thank you, Justin. I'm going to move on to councillors' questions firstly, and then I'll bring you in. I've got Councillor Rennie, I've got Councillor Gilchrist, Councillor Brame, and Councillor Clements. Thank you.
Thank you, Chair. Could I ask Dr. Mangoni if you could go back to your slide where you...
Somebody needs to help me to take it back.
Okay. Go back to the slide where you were talking about what people are saying and clearly their concerns.
Councillor Rennie, could you just move closer to the mic?
If Dr. Mangoni could go back to what people are... what does people in Wirral think? Okay, and could I perhaps ask Dr. Fraser then, if they were the sort of things that people were saying to you, could you just pick out a couple of those issues and tell me what exactly your response to those people would be? Because I've come here with a completely open mind tonight, and I'll remain like that until I see the results of the consultation after the 12th of December. But I am concerned. I realise there's a huge petition against these, but from politicians we collect petitions all the time, and people don't always necessarily understand what they're signing. And I'm not being disparaging about the people of Wirral, but you can put a petition in front of people, and a lot of people will say. So we have, I know some of the professionals on my left here have talked about that we have to educate people properly. And perhaps that isn't the right choice of words, as Councillor Burgess-Joyce said, but people, if they understand things better, they may accept those. So if you could pick out just a couple of those, perhaps Dr. Fraser, we need this kept open for our local people. Well, from what I'm understanding tonight, none of the walk-in centres or the minor injuries units are going to close, are they? From what I can see. I mean,
it's not my
sorry, within the...
I can answer that, Chair. Councillor. In fact, the consultation document is very clear. I don't know the exact page where it is, but it is say very clearly that they will be closed. They will be replaced by a uncertain 0 to 19 service that is going to do dressings by appointment and various things. But the walk-in centre services that exist today for adult population and for all population will close. That is exactly what the proposal is. And I think I would like to say is that when we have not put a petition in front of people to sign, we have given them information regarding what is going to happen, value for money, etc. And I think people are quite shocked to hear of what's being done.
So then, Chair,
I think it's on page 11 of this document. It says, close. That's exactly what this page says.
So just for clarification then, Eastern will close. They will change they will change what they do there. But Eastern will close. I didn't understand that Eastern was going to actually close. I didn't understand that Wallasey, the Lane Hospital is going to close. The services that will be offered there will be different. The actual, it's not going to close specifically.
As a result of this proposal, we would no longer have routine walk-in facilities at our current urgent care locations as follows: Eastern Clinic, Victoria Central Wallasey, Miriam Medical Centre, Parkfield Medical Centre, Morton Medical Centre.
But they're not physically closing.
I understand what you're saying. The buildings will not close, but the buildings will no longer have walk-in facilities for people to go in and provide their services. Yeah. Okay.
Services will be different than what they are at the moment. Yes?
We don't know. Because nobody is telling us exactly, because nobody has that. I can only speak on behalf of the services that we provide. Nobody has come and said to us, how will we have actually worked with the CCG to redesign our services. They wanted us to remain open 7 days a week. We have done that. They were asked to change the hours, but those are things that they have rejected. So this whole question about confusion and etc. comes because of the lack of consultation with all providers to do that.
Can we move forward now, please? If we can have Councillor Gilchrist, Councillor Gray and Councillor Clements, please, and then we need to move on to the next presentation.
Thank you, Chair. Members, if they have a chance...
Sorry, Councillor Gilchrist, could I just ask you to switch the mic off? Thank you.
I got it on or off. If members have the opportunity to look at the frequently asked questions that were updated on the 4th of October, published by the CCG, question 2 of that clarifies the point that's just been asked by Councillor Rennie. That buildings remain, but the services may change operating out of them. I want to explore with the Doctors' Federation as an aspect, please, about deprivation. Looking at maps of the indices of multiple deprivation in Wirral, councillors have been familiar with these, sadly, not changing a great deal for perhaps the 25, 30 or even 40 years. That the underlying health issues and poverty remains. I've looked at the CCG website and I've looked at the list of doctors' practices across the federations. I'm trying to establish, well, anyone can answer the questions, how this distribution of appointments might pan out in practice. When I look at the list of weekend and evening practices available recently, might be right up to date, I can see that Cllr, I can see that Riverside, Somerville, St Catherine's, Hartfield, Miriam are all clearly based on the maps I can look at in areas of deprivation. So I'd like to hear how the system will work for people who have long-standing health concerns that arise out of their poverty and lifestyle.
Could I ask that whoever feels relevant to answer that question? I'll try and keep it as brief as you can, please. Thank you.
So